Welcome to the day 3 of our Youth Convention 2025 tagged Born to Make a Statement. Hallelujah! Look at your neighbor sitting beside you. Say, you are born to make a statement.
You are born to make a statement.
You are born to make a statement. Say that with a smile on your face. Say, you are born to make a statement. Hallelujah. Okay, this section, we're going to be talking about our teeth. And I'm going to lead you with a slide. Kindly look the screen in front of you. Hallelujah. Okay, born to make a statement. Everybody's echo it together.
Born to make a statement.
Again.
Born to make a statement.
Alright. So we're going to go into our dental health talk with our youth. Okay. Just look at this TV in front of you. Alright, we're going to be talking about dental diseases. Okay, we're going to be talking about dental diseases. I will start off all by explaining what a dental disease means. Dental disease are unwanted particles in your mouth, unwanted effects that causes damages to our what? To our teeth. All of us, we all have teeth, and I believe some of us, we have some dental diseases in his or her mouth. So there's still your smiles. When you have a dental disease, you find it difficult. You find it impossible for you to smile among your peers, among your group, or in any social gathering. There's still your smiles. There's still your breath, and sometimes even your confidence, just like the dental slogan says, smile with confidence, smile with confidence. So they make you find it difficult for you to do what? To smile. Even when they are cracking jokes, maybe you're among your peers, you find it difficult for you to do what? To smile with that confidence. So today, we are going to be talking at least about 10 of them. Alright. Okay, we are going to start with dental caries. We're going to start with dental what? Dental caries. What are dental caries? If you look at the screen in front of you, you will see it. Dental caries. Those dental caries are those black spots on the surfaces of your teeth, as you can see it on the screen. They are those dark what? Those dark spots. Alright, there are those dark what? Those dark spots you see at the surfaces of your what? Of your teeth. There are stages of dental caries. Like this one you're seeing displayed now, this one is beyond the what? The first stage. Hallelujah. This one you're seeing now is beyond the what? The first stage. At first, it first starts with a what? With a dot, a black dot on your teeth. If you notice or if you have a dental caries, you find out that before the teeth start eating deep into your teeth, it will start with a spot, a black dot on your teeth. And you find out that when you're brushing, it will not go away. When you're brushing, it won't go away. You keep on brushing and brushing and brushing and brushing. It won't what? It won't go away. So you're expected at that stage to visit a what? A dental clinic. You're expected at that stage to visit your what? Your dentist. So we have different forms we can do what? We can prevent this dental what? This dental caries. We have a way we can prevent the what? The dental caries. First one is brush daily. Brush what? Daily. Some of us, when we want to brush, we just brush up, down, side, left, right, and front. So that's not the best way for me to brush. Like I said, that was our last youth convention. I said we have different words. We have 3 types of brushing techniques. The one we brush, the one that we are popularly known for, brushing. Maybe you're rushing, you're going to work, you start brushing fast, you brush up, you brush down, left, right, in and out. No, that's not the best way for you to brush. We brush from the up down. Like our toothbrush contains what? Like 3 teeth. It can carry 3 teeth. You brush it from up down. You brush it. Same thing too, from the down, you take it up. Same thing you do with those inner parts. you brush it down, the downside you take it up. And our tongue, how do we brush the tongue? We brush it, you bring out your tongue, you do it like this. Some of us used to do our tongue when we are brushing, you used to brush it fast. No, you brush it down, down. You bring out your tongue and you brush it down. So that is another way of preventing what? Dental caries. Another way is brushing twice daily. I believe some of us used to brush once in a day. It's not what? It's not hygienic. It's not good. We brush twice daily. We brush in the morning after we are done with our breakfast. In the morning after we are done with breakfast. And in the night, you brush in the night. That will be the last thing you put in your mouth before sleeping. You brush in the night. You brush in the night. You brush after your breakfast in the morning, and last thing in the night before you do what? You go to sleep. Another one is floss or use interdental what? Cleaners. I don't know if you've come across floss, a dental floss. It's like a letter F. It has something like a rope in between each edge. You use it, you put it in between your teeth, you bring it out, you put it in the other one, you bring it out, you put it just like that. You don't allow it to get so deep into your what? Into your gum. You don't allow it to get so deep into your gum. And another one is you put water in your mouth, you floss. You put water in your mouth, you rinse. You rinse it and you pour it out. You put another one, you rinse and you pour it out. So that's another method we use in what? Preventing dental caries. Another one is reduce sugar intake. Most of us, we love sugary things, including me. I love sugary things. So what I do is that anytime I notice I've taken a lot of sugary things, I do what? I rinse my mouth. I make sure I rinse my mouth. With fresh water I take in, I'll use it to do what? To rinse my mouth. I'll dispose it before I can then drink water. So that's another method of doing what? Preventing dental caries. Another one is visit the dentist regularly. I just said that. Visiting the dentist regularly. Another one is eat food-friendly food. Eat what? Eat tooth-friendly fruits like vegetable, we have fruit, so on and so what? So forth. Those are the what? Those are the methods we use in doing what? Preventing dental what? Caries. So the next slide, okay, I just finished talking about it. Tiny holes caused by sugar-loving what? Bacteria. That's the definition of dental caries. They are those what? Tiny holes. Before you know, if you don't arrest it at that tiny moment, you find out that the thing will start doing what? Escalating. It will start eating up. It will eat down into your enamel. It's then eat into your pulp. And if time is not taken, you find out that when you visit your dentist at that moment, they will tell you that you should do what? Extraction. If they find out that the teeth is or the pulp is dead, they will tell you to do what? Extraction. But at that tiny moment, if you find out that you started experiencing that dental, those tiny holes on your teeth, when you visit a dentist, the dentist or the dental therapist will be able to do what? To arrest that dental caries. They'll be able to do what? To arrest the dental caries. Okay, let's go to the next slide. So the next one we are going to be talking about is periodontal what? Diseases. Periodontal what? Diseases. You ask yourself, what is periodontal disease? Periodontal disease, also known as what? Gum what? Disease. An advanced gum disease is a serious gum infection that damages the soft tissues and destroys the bones that support your what? Your tissues. There are those what? Those serious gum infection that damages the soft tissues and destroy the bones that support your teeth. We call it the alveolar bones. Just like you can see on the slide there. It's a serious gum what? Infection. If you're not taking good care of your oral cavity, if you're not taking good care of your teeth, you find out that you start experiencing what? Gum disease, periodontal diseases. You find out you start experiencing it, which is very, 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 very wrong. And if time is not taken, it damages your gingiva, it damages your what? Your gum. Okay, let's go to the next slide. Alright, there are some risk factors that causes this what? Periodontal diseases. First one is poor oral hygiene, just like I just said. Poor oral hygiene, not taking good care of your oral cavity. It causes what? periodontal disease. You're not brushing, you're not even doing anything. In the morning when you wake up, you just rush, you eat your food, you go out to work, you're not even doing anything concerning your teeth. When you're back from work, you eat, you bathe, and you do what? You sleep. It's bad. That is poor oral hygiene. So the next one is smoking. Smoking. If you look at most smokers, if you look at their teeth, like me, if you're talking to me, the first place I look at is your teeth. I look straight to your teeth. I don't look at your face at first, just straight to your teeth. So if you look at some smokers, you find out that their teeth self is something else. Their teeth, no matter how you're brushing, no matter as long as you're smoking, you will find out that you have what? Periodontitis. The next one is diabetes. Yes, those patients that are those diabetic patients, they also do what? Encounter what? Periodontal diseases. Another one is stress, and another one is genetic factors, hereditary. If you find out that in your forefathers or maybe your generations, there is one particular person that will do what? We have that genetic factors, which is the hereditary. Okay. Alright, so we're going to be looking at the signs and symptoms of this periodontal disease. Signs and what? Symptoms. There are some things you find out in your mother. You know that yes, periodontal disease is what? Is coming. Number one is what? Swollen, red, or what? Bleeding gum. If you find out that your gum is bleeding, or your gum is what? Is tender, if you're not able to chew something well, that is a sign of what? Periodontal disease. If you find out that your gum is very red, it's a sign of what? Periodontal diseases. Another one is receding gum, that the teeth look longer. Yes, receding gums. Another thing that causes this receding gum is when you're not doing what? You're not using the proper brushing techniques. You find out that all of a sudden your teeth becoming what? Bigger, and you find that the gum is going low. It's going below the teeth, and all of a sudden your teeth becomes what? Bigger and bigger and bigger. So that is another signs of what? Periodontal disease. Another one is loose or shifting teeth. The next one is persistent bad breath, persistent halitosis. You not taking care of your oral cavity. Then pain while chewing. When your gum is swollen, or you're having bleeding, it causes you to do what? It causes pains, and you'll be unable to do what? To chew. You'll be unable to chew anything at all. Hallelujah. Okay, we are going to be looking at the prevention. How can we prevent these periodontal diseases? How can we prevent it from happening? The first one is good oral hygiene. Brushing and flossing daily. Good oral hygiene. Very, very important. That is the first step. Good oral hygiene. When you are having a good oral hygiene, you will not have this periodontal disease that we're talking about. Good oral hygiene. So the second one is regular dental cleaning. Regular dental cleaning, also known as scaling and polishing. When you visit your dentist, that is why we advise our patients to always do what? Visit the dentist, visit the dental clinic twice a year for your scaling and polishing, because when you visit them, they will be able to do what? In course of the scaling and polishing, they will be able to arrest, or they will see any dental disease maybe at its early level or stage, and do what? And arrest it from excavating to the next thing. So you do what? Regular dental cleaning. Then the third one is quit smoking. Quit smoking, and early treatment of gingivitis. Yes, that gingivitis also means gum disease. Early treatment. When you visit the dental clinic, they'll be able to do what? To arrest that gum disease. Hallelujah. Okay, we're going to go to the next. Dental abscesses. dental what? Abscesses. So what does this dental abscesses mean? It also means what? Tooth infection. A dental abscess is a painful condition where a pocket of pus forms on the tooth, gums, or what surrounding bone due to a bacterial what infection. Just as you can see on my slide. When a pus is being formed on the what? On the gum. I believe some of us used to experience this. Is a tooth what infection, and please I will advise you to visit what? The dental clinic. Visit any dental hospital. So a dental abscess is a painful condition where a pocket of pus forms on the tooth, gums, or surrounding what? Bones due to bacterial what? Infection. Just like in our mouth we have a lot of bacteria. They are friendly bacteria and harmful what? Bacteria. So you're being advised to visit your what? Your dental hospital. Always visit your dental hospital so that they will be able to do what? To arrest any early stage of what? Tooth infection. We have some risk factors of these dental abscesses. Some factors, some things that causes this what? These tooth abscesses. Number one is untreated dental caries. Untreated what? Dental caries. The second one is poor oral what? Hygiene. Poor oral hygiene causes a lot of harm to our what? To our oral cavity. Next one is gum diseases, also known as gingivitis, or we call it periodontitis. Next one is cracked or injured teeth. When your teeth is cracked, if you experience that you have a cracked teeth, please visit your what? Your dental hospital or visit a dentist, so he or she can be able to do what? To arrest it so that it won't lead to something else. So always do what? Visit your dental hospital. Very, very important, because you see this our teeth. If you're experiencing toothache, you know how it used to be. Like it will disorganize all your body system. You'll be having headache, and that headache will be affecting your eyes, and you find out that you'll be experiencing what? Discomfort. You'll not be able to do anything, even to open your mouth to talk. You'll not be doing what? Be able to do that. So visit your dentist if you're having a cracked teeth, so he or she can be able to do what? To fill it up. There's something we call dental filling. So they will be able to do what? Fill it up, and you'll have your fresh breath back again. So the next one is weakened immune system. If your immune system is weak, you will do what? You experience this dental abscesses, which is another tooth what? Infection. Hallelujah. Alright, there are some signs and symptoms of these dental what? Abscesses. First one is severe troubling toothache. Just like I said before, when you're having a severe toothache. Second one is swelling of gum, swelling of your what? Of your gum, of your face or jaw. If you experience that you're having a swollen gum, or your face is being swollen, or your jaw, please visit the hospital so they can be able to do what? To run some examination on you so as to arrest anything. So the next one is red tender gum. Red or tender gum, just like you can see on my slide. A red or a what? Tender gum. The next one we have is bad breath, or you call it foul taste in the mouth. Also, we also have fever and general what? Feeling. Fever, when you're having fever, that is another sign. General feeling of illness in severe cases. General feeling of illness in what? In severe cases. We have difficulty in opening the what? The mouth. When you're having difficulties in opening your mouth, you're having difficulties in opening your mouth, in talking, you do what? You visit your dentist. Okay, the next tooth disease we are going to be talking about is halitosis. Halitosis, also known as what? As bad breath, smelly mouth. That is called what? Halitosis. So what is this halitosis we are talking about? Let me give you the definition. Halitosis is a persistent, unpleasant what? Odor coming out from the mouth, often caused by bacteria, poor oral hygiene, or certain food and what? And habits. When you're in with your peers, you find it difficult for you to do what? To speak. You find it difficult when others are laughing. You find it difficult for you to what? To laugh. Even when you try to talk, you find out that you'll be using your hand to cover your mouth. That is what? Halitosis, and it's very, very what? It's very bad. When you're not taking good care of your oral hygiene, you find out that you have halitosis. No matter how you try to run away from it, if you're not having a good oral hygiene, you will surely have halitosis. So halitosis is a persistent, unpleasant word, odor. Is a foul word, odor. Odor that you're not even comfortable with. Hallelujah. Alright, the next we are going to be looking at the risk factors of what? Of halitosis. What are those things that causes our mouth to smell? What are those things that causes halitosis? We're going to be looking at the very, very important one, poor oral hygiene. Just like I said, poor oral hygiene causes what? Halitosis. The next one is gum disease, which is that gingivitis, or we call it periodontal diseases. They causes what? Halitosis, mouth odor. The next one is xerostomia, also known as what? Dry mouth. When you lack saliva in your mouth, or for example, maybe you stay for like 2 to 3 hours, you're not talking, you're just on your own, being sad or something else. It causes what? Halitosis. When saliva is not running in your mouth, or when you're not taking in lots of water, it causes what? Halitosis. Dry mouth, xerostomia causes what? Halitosis, mouth odor. Lack of saliva to wash away what? Bacteria. Lack of saliva to wash away bacteria. Another one is smoking or chewing what? Tobacco. Smoking or chewing tobacco. Tobacco causes what? Halitosis. The next one is strong smelling food. Strong smelling food like garlic, onions, and some what? Spices causes what? Halitosis. Certain health conditions like diabetes, sinus infections, and digestive what? Issues causes what? Halitosis. So we're going to be looking at some signs and symptoms of this halitosis we're talking about. Number one is noticeable foul odor from the mouth. White or coated tongue. If you bring out your tongue, you find out that if you've not brushed, you find out some whitish particles on the tongue. It's being coated on the what? On the tongue, on the surfaces of your what? Of your tongue. It causes what? Halitosis. Dry mouth, which I just said, or sticky saliva causes what? Halitosis. So take enough water and allow the saliva to run through your mouth so as to wash away what? Bacteria. The next one is people offering you gum or what? Mint too often. It causes bacteria. And bad taste in the what? In the mouth causes what? Halitosis. Next slide. So we have some way of preventing this halitosis. We have ways of preventing halitosis. Number one, good oral hygiene, brushing the teeth and the what? And your tongue. Very, very important. The teeth does not smell. It's the tongue that does what? That smells. So pay good attention to your tongue when you're brushing it. Remember what I said earlier. We don't brush back and front, back and front. No, we brush front. Brush it out. Don't do back front. You brush it what? You brush it out. When brushing your oral cavity, pay good attention to your what? To your tongue. I didn't say that you should not brush your teeth. No. After you finish brushing the teeth, you brush your tongue. Pay good attention to your tongue. At least when brushing, you brush twice daily with fluoride or toothpaste. Like we have that of Colgate, We have that of Pepsodent and the rest. They have what? Fluoride. The next one is floss daily to remove trapped food what? Particles. Like if you're brushing, you find out that it's not every part of your mouth that your toothbrush gets to. So what you use here is what? You use floss, you use water to do what? To floss your mouth. And also get your dental floss too. There is also called dental interdentals. You use it to plug those places, because when you're brushing, it's not every part of your mouth that the brush gets to. Like some patients have tight teeth, while some don't. So if you find out that after you finish brushing, you're still feeling maybe if you finish eating like all this aquara meat, you find out that the thing is still there after brushing. You use your dental floss, you put it in between and you take it out. Don't allow it to get so deep into your gum so you want to bleed. So you put it in between, you take it out. Just like that. You put it especially in your molars and your what? And your premolars. You put it in between, you take it out. You put it in between, you take it out. Then use water to rinse, then pour it out. So that is another way of what? Preventing halitosis. The next one is drink plenty of what? Of water. Just like I said, water and saliva help to do what? To wash away bacteria that causes what? Halitosis. Drink enough of water and allow your saliva to flow through your mouth what? Properly. So the next one is avoid tobacco products. Run away from tobacco products because it causes what? Halitosis or mouth odor. Limit food with strong odors, just like onions, garlic, and alcohol. You limit them. Or even though you're taking it, you do what? You rinse your mouth. If you're closer to your brush, you brush. If you find out that you're taking a lot of garlic, onions, you do what? You brush. So that you'll be what? Comfortable to talk. Hallelujah. The next one we'll be talking about is tooth sensitivity. Tooth sensitivity, just like you can see on my slide. Maybe let me say, for example, if you are about chewing something, you feel a very big shock on your what? On your teeth. We call it tooth sensitivity. So what is this tooth sensitivity? Tooth sensitivity, also called dentine hypersensitivity, is a sharp, sudden pain, a very sharp, sudden pain or discomfort in one or more teeth when exposed to what? Hot water, cold, sweet, or acidic food and what? And drinks, or even what? Brushing. There are sharp pains. Sharp pains. Maybe when you want to chew anything, you want to take maybe cold water and the rest, you feel these sharp pains. It won't last for up to let me say 3 to 5 minutes. No, it's a very sharp pains. You feel it. So that is called what? Tooth sensitivity or dentine hypersensitivity. So there are some things that we do that causes this what? Tooth sensitivities. There are some activities we do that causes this what? Tooth sensitivity. These risk factors. So number one is brushing too hard. Brushing too hard. Some of us, whenever we want to brush, we use our strength and be brushing the teeth so that the teeth will be clean. No. Don't brush too hard. And another thing is hard toothbrush. If you find out that your toothbrush, the bristles, they are too strong, it's not good, it's not healthy for your teeth. You're advised to use not too hard and not too strong bristles when brushing. And ideal toothbrush, at the end, at the beginning of it we have something like a triangular shape at the tip of it. So don't use too much hard or too soft bristles when you're brushing, and don't use force to brush. You brush gently, because if you're brushing hard, you'll be wearing down your tooth enamel, and once your enamel is being exposed, That one is a serious tooth what sensitivity. The enamel is that inner white. How will I explain this inner white? If you're looking at your teeth, maybe for example, if you have a broken teeth, there's this whitish part of the teeth. If that place is being exposed, you'll be experiencing tooth what sensitivity, and you're being advised to visit your dental hospital, so they will know if you're to do dental filling or anything. So the next one is your gum resection, exposing your tooth root or exposing your enamel causes tooth sensitivity. Next one is tooth decay or cavity. Dental caries. Once you start experiencing that, once your tooth is being exposed, it causes tooth sensitivity. The next one is cracked or chipped teeth, wound fillings or dental work. Another one is acidic food and drinks. Acidic food and drinks causes tooth sensitivity. Next one is tooth grinding. When you're grinding your teeth, we'll be talking about that. We call it bruxism. When you're grinding your teeth, it will expose your enamel. There's no way you run about it. It will expose your teeth, and your enamel will be exposed. Another one is using whitening product excessively. It's bad. That is why as I am like this, I won't advise anyone to go and do teeth whitening 2 times a year. No, it's not advisable. And it's not everyone that knows how to even do it. Some of them might use the chemical excess. Before you know, you start doing experiencing tooth sensitivity. To going for teeth whitening. What is wrong with your teeth? When you pay good attention to your teeth, it becomes white. So to me, there's no need of doing teeth whitening. Just pay good attention to your teeth, brush regularly, do what you're asked to do, and you have a fresh breath. Hallelujah. So we're going to be looking at some signs and symptoms of tooth sensitivity. Signs and symptoms of tooth sensitivity. Number 1 is sudden sharp pain when eating, drinking hot water, sweet or acidic food. That is another signs and symptoms of tooth sensitivity. Another one is discomfort when breathing in cold air. Discomfort when breathing in cold air. Pain when brushing or flossing sensitive teeth, and pain that comes and go, not constant like toothache. So that is the signs and symptoms of tooth sensitivity. Next one. So we are going to be looking at the prevention. How can we prevent this tooth sensitivity? How can we prevent these sharp pains from occurring on our teeth? Number 1 is brush gently with a soft bristled toothbrush. When you're brushing gently. Brush gently with a soft toothbrush. The next one is use sensitive toothpaste. Use sensitive toothpaste, the one that has fluoride in it. Just like I mentioned before, I said we use Colgate and Pepsodent. The next one is avoid acidic food. Avoid acidic food and drinks. You avoid them. Example of this acidic food is we have pineapple or unripe pineapple. When you're talking unripe pineapple, it causes tooth sensitivity. Another one is rinse mouth with water afterwards. You do what? You rinse your mouth. After you finish taking all these things, you do what? You rinse your mouth properly with water. If possible, if you have warm water by your side, or if you're in the house, you take what? You use warm water to do what? To rinse your mouth. The next one is don't grind your teeth. Don't do what? Grind your teeth. And if you find out that you're having this bruising, you do what? Visit your dentist. Then the dentist will give you something that you will use at night if need be, and you will use at night during sleeping to prevent this bruising. The next one is regular dental checkup. Regular dental checkup for early detection of gum resection or cavity, and maintain proper oral hygiene without over brushing. Hallelujah. Alright, we'll be looking at another dental disease known as gingivitis. Just like you can see on my slide, gingivitis, also known as what? Bleeding of the what? Of the gum. So let's look at the definition. What is this gingivitis? What is this gum bleeding or bleeding of the gum that we're talking about? Gingivitis is the early stage of gum disease where the gums becomes what? Red. The gums become what? Reddish, swollen, and you easily do what? Bleed. For example, if you just carry your toothbrush and just touch it on your teeth, you find out that you start bleeding. Or on your own, you find out that you start doing what? You start bleeding. It's known as gingivitis. It's usually because of plaque what built up on the teeth. It's usually because of what? Plaque built up on the what? On the teeth. It is reversible with proper care. Yes, if you find out that you are having this what? Gum disease, make sure you visit your dental hospital. They are going to do scaling and what? Polishing, and find out that if you are having any plaque or calculus on your teeth, they will do what? They will remove it because of the what? Scaling and polishing. We will call it S and P. So always do what? Visit your dental hospital. Hallelujah. Next one. So we're going to be looking on some risk factors, things that causes this what? Gingivitis. Number one is poor oral hygiene, not brushing and flossing well. The second one is smoking or chewing what? Tobacco. Diabetes and other health what? Condition causes this gingivitis. We have hormonal what? Changes like pregnancy and what? Menstruation. It causes what? Gingivitis. We have certain medications that reduces what? Saliva. When the saliva is not flowing properly in the mouth, it causes what? Gingivitis. And another one is poor nutrition, especially vitamin C deficiency. Poor nutrition. When you're not eating healthy food, causes what? Gingivitis. So there are some signs and symptoms of this gingivitis. Number one is red or dark gums instead of healthy what? Pink. Instead of what? Healthy pink. Our gum is supposed to be what? Pink. So when you find out that your gum is red or dark, you do what? You visit your dental hospital so that they can be able to do what? To arrest that gingivitis. Because one of the things that causes gingivitis is plaque and what? Calculus. If you look at some people's teeth, you find out some dark spot beneath their teeth. In between the teeth and the gum, you find out some dark or brown something there. It's called dental plaque or calculus. So you visit your dental hospital so they can be able to do what? To wash your teeth. If you do proper washing, yes, they can arrest that gingivitis. When you do proper washing, they can arrest the what? Gingivitis. Another one is swollen tender gums, bleeding while brushing or flossing. Visit the dental hospital. Persistent what? Bad breath, halitosis, mouth odor causes what? Gingivitis. So pay good attention to your what? Oral cavity. Another one is gum recession. Remember what I said about gum recession? Yes. Gum recession, pulling away from the what? Teeth, your gum pulling away from the teeth, and all of a sudden you find out that your gum your teeth start becoming what? Big. You find out that your teeth start becoming what? Big. It's known as gum recession. Your gum moving away from your what? From your teeth due to your brushing techniques. So that is what? That is bad. So there are some ways we can do what? We can prevent this dental what? We can prevent this gingivitis, this dental disease. Number one is brush your teeth twice a day with fluoride what? Toothpaste. Always use a toothpaste that has fluoride on it because it has a lot to do on your teeth. It has a lot to do on your oral cavity. When you're using a toothpaste that contains what? Fluoride, it has a lot and it plays a lot of roles in your oral what cavity. Don't forget fluoride. The next one is floss daily to remove what hidden plaque. Just like I said, it's not every particles from your mouth that your brush can remove. No, it's not every what particles. So you also floss to help your oral cavity. Always floss and use interdentals. Just like I said, the dental what floss. You use it to remove some other particles from your teeth. The next one is visit the dentist regularly. Very, very important for cleaning and what check up. For cleaning, you see this SRP has a lot to do in our oral cavity. It has a lot because when you're doing that, you find out that you also arrest some other dental diseases. Just like I said, the cavities and the rest. When you're doing S&P, it does what plays a lot of roles in your oral cavity. It helps to fight against what periodontitis. So always do what visit your dental clinic. Hallelujah. So the next one is quit smoking and reduce alcohol intake. Eat a balanced diet with enough vitamins and minerals, and use antimicrobial mouthwash if recommended. That is if your dentist recommend that for you to use antimicrobial mouthwash. We have different kind of mouthwash. So visit your dentist. Visit the dental hospital so they will tell you what and what for you to use to prevent the gingivitis. The next one we'll be talking about is bruising, gnashing of your teeth. When you're grinding your teeth, for example, you yourself, you will not even know. You will not know that you're even doing that. Maybe sometimes anxiety used to cause that, or maybe if you're happy, you find out that you will not even know, you start doing it. When that has become your habit, grinding of your teeth. So let's look at the definition. What is this bruising we are talking about? Bruising is the habitual grinding. The habitual grinding, clenching or gnashing of of teeth, often unconsciously during sleep. Most people do that during sleep. You will not even know, except maybe somebody that is sleeping beside you tells you that when you're sleeping you're grinding your teeth, or when you're sleeping you're gnashing your teeth. Or while awake, it can damage your teeth, your gum and your jaw point. It damages. You find out that some of your teeth will not be equal, and you find out that when you're doing that thing, you find out that you expose your enamel. Once your enamel is being exposed, you're welcoming inwards tooth sensitivity. Your teeth will not be like normal again. So bruising makes your teeth not to be equal and attract other dental diseases to your teeth. So there are some things we do. That causes this bruising. For example, we have stress. When you're overstressed, anxiety or tension, you find out that you start gnashing your teeth. Next one is sleeping disorder, like a sleeping disorder. The next one is misaligned teeth or abnormal bites. Like we have different types of bites. We have underbite, you have overbite, you have jet bite. Different types of bites. So misaligned teeth or abnormal bites causes this bruising. Just as you can see on my slide. The next one is certain medication. Example, we have antidepressants. It causes bruising. Next one is caffeine, alcohol, or smoking causes bruising. Personality traits such as hyperactivity or competitiveness causes bruising. Hallelujah. Next slide. So we are going to be looking at some management, or we call prevention of this bruising. The first one is stress management. How can we do that? You use relaxation techniques. I believe many of us we know about relaxation techniques, a process whereby you sit down, you cross your leg and you're just meditating. So we use counseling or exercise. It helps to reduce the stress what? Bruising. Next one is mouth guide or night guide. That is why you're being advised to visit your dentist so they will know what and what to give to you. So if you're using that, it helps to do what? To prevent bruising and to protect your teeth while doing what? Sleeping. Avoid excessive caffeine, alcohol or smoking. Next one is correct misaligned teeth if necessary by using orthodontics what? Materials. It will be prescribed by your what? By your dentist. Next one is maintain good sleep hygiene. Maintain what? Good sleep hygiene, regular sleep pattern, calming bedtime routine, and gentle jaw what? Exercise. Gentle what? Jaw exercise. Hallelujah. So next one we'll be talking about is scaling and polishing. Scaling and polishing. Scaling and polishing. Next slide. Scaling and polishing. What do you understand by scaling and polishing? I'm going to give you the definition of scaling and I'm going to give you the definition of what? Polishing. Scaling and polishing does not mean the same thing. No. So what is dental scaling? Dental scaling can be defined as a deep cleaning that removes tartar and plaque. That removes tartar and plaque from your teeth, which your brush cannot do what? Handle. For example, we have something we call heavy mouth and fine mouth. Heavy mouth. Heavy mouth, if you look at some people's teeth, you find out that you see a very thick particles beneath, or let me say in between their gum and their what? Gingiva, or beneath their teeth. You see a very thick particles there. Some of them, the thing might stay for some, or if you leave it for some time, you find out that the thing from brown it will change to what? To black. Some of them it change, you see some green. So that is called what? The removal of those things are called scaling. They are called scaling. Scaling is the removal of heavy what? Particles. The removal of tartar. The removal of calculus from your what? Calculus and plaque from your what? From your teeth. Your brush cannot remove it. No matter how you brush, you find out that you will keep on bleeding. If you're brushing, you're using brush, saying you want to remove it, you will not remove it. There's no way you can remove heavy calculus on your teeth with just brush. No. So if you find out that you keep on brushing for months just to remove that and the thing refuses to go out, my dear, visit the what? The dental hospital, or visit your dentist. They are going to do what we call scaling. They will scale it to remove that what? That plaque or that tartar from your what? From your teeth. So what is the importance of this scaling? We are talking about scaling. What are the importance? Number one, stop gum disease early. Once you start noticing that bleeding and you visit your dental hospital, they are going to do scaling. And once they do that scaling, it will stop it as long as you visited the hospital, immediately you start noticing that stuff. Once you visit it, your early stage of that gum disease, that gingivitis, it will cease. Once you go for that scaling, it will cease. The next one is it kicks out bad breath, halitosis. It kicks out what? Halitosis from the oral what? Cavity. The next one is that it keeps your gum what? Strong, and you find out that your gum becomes pink. That is a healthy gum. A healthy gum is a gum that is what? Pink color. You find out that it is dark or it is red, you visit your what? Dental hospital. So it keeps gums what? Strong. The next one is that it protects overall what? Health. Scaling protects overall what? Health. Scaling is like evicting unwanted quarters from your what? From your mouth. Removing debris, food particles from your what? From your mouth. Scaling helps you to do what? To do that. is all about scaling. So now we're going to be looking at polishing. What is polishing? We used to hear S&P, scaling and polishing. What is polishing? Polishing is the glow up, smoothing, and the shining teeth afterwards scaling. It's like you polishing the teeth after you're done with the scaling. Like I said, scaling is the removal of what? Heavy particles. This one now is just like you polishing it, just like the name implies. Polish is the glow up, the smoothing, and the shining of the teeth after you doing what? After you finish scaling. After you finish doing what? Scaling. You cannot do polishing without scaling. It's not possible. You can't do polishing without scaling. So polishing is the process of you doing what? Glowing up, smoothing, and shining the teeth after you're done scaling. So what are the importance of this polishing that we're talking about? What are the importance? Number one, it removes stain. It removes what? Stains. Polishing removes what? Stain. It says bye bye to coke, suya, shawarma, and the rest. Sweet. The next one is it boosts your what? Confidence. It makes you to smile among your peers with what? Confidence. Just like our slogan says. Smile with what? Confidence. Smile with what?
Confidence.
Yes.
Yes.
So when you do polishing, it makes you to smile with confidence among your peers. You just find out that you start shining your teeth. Maybe I can remember that was 2 years ago we did S&P in the church, and one of our brother that we washed his teeth and the teeth was shining. All of a sudden, the person, you will not even see any funny teeth. You see the person shining his teeth. And you yourself, you start smiling. Hallelujah. You start smiling because you don't see the person shining his teeth. Hallelujah. So polishing helps you to do what? Boost your confidence and makes you to smile. Another one is that it makes your teeth smooth. It makes your teeth what? Smooth. If you're done doing S&P, just use your tongue and go around your teeth. You find out that your teeth will become what? Smooth. You will not be seeing those thick things on your teeth again. You will not be seeing them. It makes your teeth what? Smooth. Alright, another one is it leaves you camera ready. Hallelujah. And another thing about this polishing is that this polishing makes hallelujah. Hallelujah. So we are all advised to go for our scaling and polishing at least twice a year. Twice a what? A year. Very, very, very important. Go for your scaling and polishing. So your dentist or your dental therapist or hygienist will be able to do what? To arrest any early stage of what? Dental diseases. They will be able to arrest any stage at all of any dental disease. Just like we said before, we have the dental cavities or caries, the halitosis, tooth sensitivity, exposure of your enamel, and the rest. If you go for it, they'll be able to do what? To arrest it. If you go late for it, maybe you're saying, there's no money, there's no this, there's no that. You find out that thing will keep on what? Excavating, going around your teeth, and all of a sudden, then your tooth will die. And once you go to the hospital for treatment at the late hour, they will tell you to go and do extraction, or you go and do ROCT. ROCT is very, very expensive, but it's better you go for scaling and polishing. It's better you go for scaling and polishing. Because if you don't go for scaling and polishing, you will then go for extraction or ROCT. Most people go for extraction because it's cheaper than ROCT. It's less expensive than ROCT. Hallelujah. Okay, I'm done with my teaching. I believe some of you might have some questions you would like to ask. You have some questions you would like to ask. If you have some questions. If you have some questions. I don't know. Do you have a question you would like to ask?
See someone teeth
Okay.
is for 3 years and the person has no brush. Then the teeth is already dark. Like I used to see some people that is like black as charcoal, more than charcoal sef. But can they still clean the teeth to be as whiter than snow? Or can they still do something?
Okay. First of all, that is why we advise people to go for scaling and polishing twice a year. Okay, a situation whereby a teeth is like that, there is no magic we can do. There is no magic. We can only do the one that we can do and leave the rest for you to do. We also tell them to do or pay good attention, brush the teeth, brush properly. So in situation whereby maybe the person's teeth is dark, but there is no way somebody's teeth without brushing can be dark for just 3 years. No.
Snow, those people that usually take snow. Their teeth.
There are some stains that on a patient's teeth, there are some stains we call intrinsic and extrinsic. Some stains cannot go out. So in a situation whereby maybe the person has such stains, you just wash it and advise the person to brush properly. Any other question? Any other question?
I don't know what causes bad breath. The ocean.
Alright.
Why you mentioned garlic. You mentioned garlic. But I think people are chewing garlic. It is heavy.
Okay, some causes of this halitosis, known as bad breath, we're talking about. Number one is poor oral hygiene. If you're not paying good attention to your oral hygiene, you have halitosis. You will definitely have what? Halitosis. Another one is xerostomia, dry mouth. When you're not allowing saliva to flow well or you're not taking enough water, it causes what? Halitosis. And that of garlic that you're talking about. When you finish taking garlic, maybe some of them or most of them, because garlic here to smell in your mouth. What I believe what most of them used to do is that they either raise their mouth or they brush or they take all this mint, this sweets, just to do what? To wash it out. So if you're taking that, make sure you do what? You raise your mouth. If possible, if you're in the house, use warm water to do what? To raise your mouth. Very, very what? Important. So it's not only garlic does not only cause halitosis. What causes halitosis? The important one that causes halitosis is poor oral what? Hygiene. When you're not taking good care of your what? Oral cavity, it causes what? Halitosis. So pay good attention to your what? Oral hygiene. Next question. Alright, I believe there's no other question.
Okay, I think the last question I was asked about garlic, why you said they shouldn't eat garlic. I don't know if that was what was said.
So I said if you're taking garlic, you rinse your mouth with warm water.
Okay.
Very, very important. So if you're closer to your brush, then you can brush.
Oh, okay. Because I was thinking maybe he was asking the question why I see people eating garlic and all that. Because garlic actually has a very strong, potent aroma. Let me use that word. And it's also antibiotics. And I now I get the balance. It's that balance I wanted from what you were saying. And just to add to that, I was saying, also, maybe you have presentations, you have meeting. The person can also avoid the garlic for that period of time. When you get back home, you can have your garlic and then rinse your mouth, just like our teacher has taught us today. Thank you, Mom.
Thank you.
Do it like twice a year. So we want to know whether it's affordable. Normally, if you are going to see a dental therapist or to go and see a dentist or go to a dental clinic and we want to do scaling and polishing twice a year like you recommended, how much does it cost?
Okay, if you're to do a professional dental scaling and polishing at some hospital, let me say, they charge 30,000.
30,000 naira. Thank you very much. And that's what we're getting for free today. Let's put our hands together for our resource person. If you don't clap well, it will not be. So by the time we calculate the number of people that are going to get scaling and polishing today for free, just multiply that by 30,000 naira. That's what they're getting free of charge. So we want to appreciate our resource person. So all those who want to go for scaling and polishing, please, once we are done with this session, please just go on. I think our dental therapists will be outside to attend to you. Just go to that scaling and polishing, go on, and then we'll move on to our next session. The next session will be where we'll be learning. Our resource person will be teaching us about foods that heal, how to cook food that heal, the kind of food that we need to eat to heal different kind of sickness and diseases. So people don't know that what we are eating is what is causing sicknesses and diseases. We don't even know. So the next resource person is very vast in that area. He's a specialist, and I know we're going to enjoy the next session. So we're going to take a break for 5 minutes now, and all those that for the dental, for scaling and polishing, please, you can just meet our resource person outside, and those who are attending to each other will be attending to you. In 5 minutes time, those who are here for to learn how to cook meals or to know about the kind of foods that heal sicknesses and different kind of diseases, then that session will take place in 5 minutes. And don't forget, the theme of this convention is born to make a statement. So I'm going to shout now. We are told that if you don't brush well, you cannot make a statement. That you need to brush well. Where is that slide? Can you take me that slide? It says so that you make a statement with confidence. So you want to make a statement of confidence, you need to take care of your teeth. But let's say, Shama Youths, I want to make a statement. Shama Youths, want to make a statement, I will make my statement. God bless you. See you in the next session.